Hey gang, it's Dr. T. Today I'm going to talk about the difference between a Skinny BBL and a Country Club BBL. So these two terms are related but not the same, and they're both trending right now. So as an expert in these procedures, I'm going to explain them to you. So the first is a Skinny BBL. So a Skinny BBL is a BBL that's done in a patient who's very thin with low body fat percentage, often with a BMI of 20 or lower. So these patients often come to me having gone to several other surgeons who have told them they don't have enough fat, that they have to gain weight in order to get a BBL. So let's give an example. So here's a patient who would be considered a skinny BBL, a BMI of say 21 or 22, very little fat, and we have to harvest enough fat to give her a BBL, a better shape. So in a skinny BBL, again, very little fat. We have to snatch the waist to get a lot of fat out of the waist area. Sometimes we go to the inner thighs, the arms to get fat to give the patient, in this case, about 700 cc's each side to get a nice BBL. So skinny BBLs actually are very difficult to do. They're more difficult. Why? Because not only is it harder to harvest fat in a thin person, but because the fat layer is so thin, it's also very unforgiving, so there's very little margin for error. So when you're doing liposuction, you have to make sure that you don't leave any irregularities in these areas, that the skin looks smooth, that the area is even. So it's, again, requires a certain special set of skills and experience to do a skinny BBL. Okay, let's move on to the Country Club BBL. So this is a trending term, okay? A Country Club BBL can also be done in a thin patient. So I'm going to give you a little bit of history because it has more to do with the result than with the patient themselves. So about 2 years ago, when BBLs were reaching the height of their popularity, I was doing a lot of BBLs, and then I started noticing patients coming to me requesting maybe a little bit of a different type of result. These patients were often professionals or models or someone who's in the public eye, or yoga instructors who didn't want that dramatic wide hip, that 1-to-2 golden ratio, waist to hip ratio look that a lot of BBL patients were asking for. They wanted a more conservative look, kind of more athletic, more fit look. So the Country Club BBL, so I coined the term Country Club BBL to describe this type of BBL. So here's an example. So here's an example of a patient who, again, is very thin, so it would be considered a skinny BBL. So we have to harvest fat, find fat in this patient. But when we do her BBL, we are less focused on bringing out the hips. We still snatch the waist, but we're more focused on providing projection, providing a more natural look. We still fill in the hip dips, still give that projection, but we're less concerned with widening of the hips, less concerned with the curve, more concerned with kind of maintaining a fit, kind of more natural look. So because it's a more conservative look, I decided to call it a Country Club BBL. So I'm actually doing a lot more of these. It seems to be kind of a trending thing now for BBLs to be, not so dramatic anymore. And so I'm getting a lot of requests for the Country Club BBL. I'm also getting a lot of requests for patients coming to me for skinny BBL because, again, that's my specialty. So if you're a thin patient or you're looking for a BBL that's not so dramatic, that looks more natural, more fit, more elegant, and you need a more conservative look, and you want a Country Club BBL, I'm your guy. So I'm Dr. Breast and Body in Chicago. Come see me, and I will see you guys soon.